Hi, this paper is about epilepsy. It will include a definition of what epilepsy is and also its history. It will then be followed by a discussion on its current medical history and also a summary of treatment options. What is epilepsy? Epilepsy is a chronic neurological disorder that is characterized by seizures. Seizures can be unprovoked and reoccurring at times, but in some, it only requires one single seizure that unites with brain alteration, which will higher the chance of any seizures happening in the future. An epileptic seizure causes muscle convulsion and limited consciousness. There are also several types of epileptic seizures that vary in seriousness. In many patients, the cause of seizure cannot be identified, but most of the time it is known to include brain trauma, strokes, brain cancer, drug and or alcohol use. Worldwide, there are about 50 million people who currently have epilepsy. The onset of new symptoms happens in infants and elderly, but it is known to get worse or more common as people age. Epilepsy can be controlled most of the time, but is not 100% curable with medication, and about 30% of these patients won't get any control at all. As a result of surgery, the seizures can get worse, or possibly patients that didn't have seizures in the first place could get seizures. In most cases, epilepsy is lifelong. However, it would come in stages throughout one's life, and with some of the most difficult cases, most consider surgery. How is epilepsy diagnosed? Usually, a diagnosis for epilepsy will require a patient to have seizures that are spontaneous. This could be difficult knowing that many epileptic seizures only occur with a trigger. This is also called reflex epilepsy. There is also an epilepsy where women have seizures that are triggered by her menstrual cycle. Some other triggers can include flashing lights, stress, reading, alcohol, heat, and even sleeping. And these triggers are used to diagnose patients for different epilepsies a lot of the time. In neonatal and early infancy, epilepsy can cause different infections, disorders, and also trauma. Upon the late stages of infancy and early childhood, epilepsy will cause some early signs of seizures that can occur, and as the child goes into late childhood, these signs will become clearer to a physician and should be able to define one specific epilepsy. As this epilepsy patient goes into adolescence and also adulthood, some lesions which are abnormal tissue growths on the body will start to appear, and as the adult gets older, diseases are common along with tumors and also dementia. How is epilepsy classified? There are 5 ways in which epilepsy is classified. They're by their cause, signs, location, medical syndrome, and also by the event that triggers the seizure. The International League Against Epilepsy has been currently working on a new classification that includes the state or event of the seizure, seizure type, the syndrome, the cause, and also impairment. What are seizures? A seizure is structured around whether the seizure in the brain is localized or distributed. A localized seizure, also known as partial or focal seizure, is when the seizure only affects one part of the brain and serves as a driver for the epileptic response. A distributed seizure affects more than one part of the brain, and a partial seizure is when a person's awareness is affected, but a simple partial seizure is when the person's awareness is unaffected. A process known as secondary generalization is when a partial seizure spreads to the brain, and a generalized seizure are circuits and involves the loss of consciousness and are epilepsies that have an unknown location and are still uncertain if they involve a small portion of the brain or a larger circuit. Some mistake children for having epilepsy by their behaviors. They may partake in things like inactiveness, staring, self-gratification, and conversation disorders. The different types of epilepsies. There are 4 key groups of epilepsy syndromes that include their very own rare mixture of seizure type. This can include their age, findings, treatment, and prognosis. To classify the epilepsy, you need in-depth information and also the different episodes they have rather than the seizure itself. The most common classification of epilepsy separates the syndrome by their location and distribution and also their cause, and then next it is separated by their location, generalization, and then put under an unknown location. The syndromes are further separated by assumed cause, which can include idiopathic, which are genetic abnormalities, symptomatic, that affects either a focal or defect lesion, and then cryptogenetic, which are lesions that are very hard or even impossible to find. It is difficult to classify some epileptic syndromes that fall into the unknown category, which is when one seizure occurs after something specific. How to manage epilepsy. Usually epilepsy is treated with medication given by the patient's physician. It can include their primary caregiver, their neurologist or neurosurgeon, who are all common physicians who care for those who have epilepsy. Finding the right treatment is really difficult for the physician to do because he has to be 100% certain that the patient either has a generalized or partial seizure. Sometimes implantations or specific diets can help with these seizures, and even neurosurgeons who operate try to reduce these seizures, and all of those can be helpful. How to assist someone who is having a seizure. When someone is having a generalized seizure, it is important for the person helping to roll them over onto their side so that the fluid can come out instead of them either choking on it or the fluid going into their lungs. It would also be really important for those people to move the person away from sharp objects so that they don't hit their head or hurt themselves. If the seizure has continued for more than 5 minutes and they have not gained consciousness back, it is crucial to call medical assistance to help you. The main treatment for epilepsy is anticonvulsant medication, but the effectiveness differs between each epilepsy syndrome. These medications are always lifelong and affects their quality of life, and the Food and Drug Administration has approved over 20 medications that are being used in the U.S. However, there are still medications outside the U.S. that are still being used. There are drugs that interrupt the seizure, and then there are others that just treat stubborn epilepsies. There are also limited trials that the FDA has not approved, and many of these anticonvulsant medications are being used during a short time. A lot of these drugs will be grandfathered in, but are usually put back under evaluation. The FDA requirements usually include 50% of patients being treated in a group, and of those patients, 50% of them must have an improvement rate. And 20% of patients who are on the best anticonvulsant medications will most likely not see a change. In a European study, about 88% of patients taking these medications will have side effects that could include sleepiness or mood change, but could sometimes be avoided by changing their dose of medication. It is also important for women on these medications to contact their physician if they become pregnant. The goal for epileptic patients is to have no seizures with little or no side effects, which is why it's the physician's job to make sure that they're on the best medications and have a good balance of medications. Many patients require more than one anticonvulsant medication, but to get this good balance, a patient would have to be on only one, which is why it's hard to achieve this goal that every patient wants. A patient who is only on one anticonvulsant medication is called monotherapy, which is recommended because it helps with lowering the side effects that some of these medications have. Patients with epilepsy whose seizures cannot be put under control with 2 or more anticonvulsant medications, it is generally said that their epilepsy is medically refractory. And patients who start medications for the very first time usually will see a 47% control of seizures, but only 14% of patients who are on their second or third trial of drugs usually become seizure-free. There are also patients who decide not to try anticonvulsant medications, so they will usually choose a different method of treatment. The goal for surgery is to take control over the seizures. However, sometimes it's possible that anticonvulsant medications will still be used after surgery. In order to get this surgery, physicians must be positive that the seizures are coming from epilepsy, and they also must locate where the seizure is coming from so that in surgery they do not harm any normal brain tissue or function. The physician's evaluation will include a neurological examination, an EEG along with life-term video EEG, a neurophysiological examination, and an MRI. Some epilepsy centers use WADE, MRI, and MEG tests. Long-term video EEG monitoring is used to identify the epileptic focus so that physicians can target that specific area in surgery instead of hitting a normal brain tissue or function. Instead of using long-term video EEG, electronical stimulation is also used in some patients. Most surgeries are done to remove lesions and tumors so that the epileptic seizures can be put under control. The most common epilepsy in adults is intractable epilepsy, and it is where the epilepsy is the main symptom. In temporal lobe epilepsy, it is one of the forms of intractable epilepsy and is the most common type of surgery for epilepsy, and it is to remove the front portion of the temporal lobe. Temporal lobe epilepsy surgery has been known to be really effective and durable. The only reason why some patients will end up not doing it is because of the fear that they're undergoing brain surgery. Some surgeries are intended to prevent seizures or loss of consciousness. Therefore, it helps with preventing injuries due to these events. Resective surgery has the expectation of reducing but not entirely eliminating these seizures. There are also some surgeries that can help with decreasing the spread of seizures across the cortex so that it doesn't hurt the functional surrounding area, and others that disconnect all or most of the cerebrum and is only for patients with extreme epilepsies. For younger patients, these surgeries have been known to affect their motor control skills, and in older patients, it can also affect their motor control, but only on one side, which is usually the opposite part of the brain of where it was operated on. Therefore, because of the intense side effects, these surgeries are usually done with patients who have tried every other treatment option and were just unsuccessful. An estimated 3% of people will have epilepsy at some point in their lifetime, and about 5 to 10 people out of 1,000 will have active epilepsy, which is the most common neurological disorder. Developmental conditions are likely in younger patients, but in patients who are over 40, it is more likely for them to have tumors. It is common for all age groups to have trauma and infections, and in only about 5% who don't experience seizures within some point of their life. The estimated annual incident rate is 40 to 7 per 100,000 in industrial countries, but it has decreased in children, but increased in elderly. And in poor countries, the annual rate is about 100 to 190 per 100,000. People with epilepsy are at risk of death. That can include trauma, unexpected death, and even suicide. Patients who are at risk for death usually have poorly controlled seizures, or also have underlying neurological issues. In the UK, there is approximately 1,000 annual deaths that are reported due to epileptic seizures. There are also certain disorders that have been associated with epilepsy, which can include depression, anxiety, migraines, infertility, and also low sex drive. ADHD affects 3 to 5 times more in children with epilepsy than children without epilepsy, and the mix has serious consequences that can include learning and social development, and also behavioral problems. The word epilepsy means to take hold of or to seize, and comes from the ancient Greek, but in ancient times it was known as a sacred disease. Early on, epilepsy was often called falling sickness, falling ill, or falling evil, and was known to be associated with religion or demonic possession. It was also often thought to be an attack by demons. Many religious communities would describe epilepsy as loss of consciousness or supernatural. People with epilepsy have been shunned in most cultures and have been categorized under the mentally ill or criminally insane. Till this day, many parts of Africa consider people with epilepsy to be poisoned, involved in witchcraft, or possessed by evil spirits. In northern Italy and the ancient Rome, epilepsy is known to be a curse by the gods. There are many jurisdictions that don't allow people with epilepsy to do certain activities, which can include driving a car or other types of machinery unless they can prove that their condition is stabilized. In the U.S., it depends on the licensing agency of each state that determines if people with epilepsy can drive, their seizures are controlled with treatment. It also depends on each state on the amount of time that someone needs to be seizure-free before their privileges are returned, and it can be usually between 3 months and a year. In most U.S. states, it is the patient's responsibility to report their condition so that their privileges can be revoked, but in others, it is the physician's responsibility to report to the driver's license agency. And the driver's license agency will always have the last decision to either revoke or restrict their license. In the UK, the patients must directly inform the driver and licensing agency if they have epilepsy. These rules are very intense, and they cannot drive if they have had a seizure within the last 6 months or under medication changes, and can only apply for a license if they have been seizure-free for over a year. A patient's physician has the right to inform the DVLA and break their doctor-patient confidentiality if they find out that their patient has been driving with uncontrolled seizures. And in many countries, people with a history of epilepsy are usually disqualified in getting their pilot's license, but in the U.S., there has been rare cases with people who have only had a few seizures as a child, but have remained seizure-free in adulthood without medication, and they are qualified for getting their pilot license. In the UK, they follow the same rules as they do with their motor vehicles. They can only get their pilot license if they have been seizure-free for over a year without being on medication. In conclusion, epilepsy is a chronic neurological disorder that many people of different age groups have all over the world. It has been around since the ancient times. It has been considered many different things, not just a disorder. There are different types of epilepsies of their own severities, and many different treatment options that could include medication and surgeries. It is hard to get a good balance of medications, but people with epilepsy have learned to manage. There are also very good tips when it comes to helping an epileptic having a seizure. Thank you.